Back we continue then with our Youth Day coverage, and we look now at research that has revealed that the KwaZulu-Natal, KwaZulu-Natal reported a higher percentage for births registered at home affairs, as well as those that were delivered in public health facilities. Limpopo reported higher rates of termination of pregnancy in the 3 years between 2017 and 2019. Meanwhile, Gauteng recorded higher proportions of adolescents who visited a mental health facility in 2019 and 2020. Now, these are just some of the findings out of the Stats SA survey on the state of youth and adolescent health in South Africa. Joining us now for some insight on the meaning of such numbers is Dr. Linda Ncube Nkomo, CEO of the LoveLife Trust. Dr. Nkomo, good evening and thank you very much for your time. I'm sure you've got this snapshot from where you are sitting. What is a picture that is beginning to emerge, firstly around the sexual reproductive health issues, around mental health, but also around other more terminal illnesses that young people are dealing with right now, and what are the main drivers and causes of those patterns?
Thabo, good evening and thank you for the invitation to be with you this evening. You've asked a lot of questions, so I hope I'll be able to do justice to them. I think the picture, the numbers that you've just shared to start this part of the show, as you said, are talking to adolescent and teen births in state facilities. And I think what they are telling us is the story that children are giving birth. But what we're not getting to the bottom of, or what we're not seeing after those numbers are released, are the consequences of the adults that have known that a child is pregnant. And in a lot of instances, you know, we're talking 10-year-olds, when children that young are pregnant. There's an adult who knows, who's not taken the child to a state facility so that at that age, really that pregnancy should be terminated, who's not linked a child to a social worker. There's an adult who should be arrested for raping a child, and we're not hearing anything after those numbers are released. Yeah. So those numbers are telling us of abuse of children, adults complicit, and then the story ends there with the numbers. Then if we look at the mental health picture, I don't think is a surprising picture. If you look at what young people have been dealing with over the years, and then you add a COVID layer to that, it is a picture that is telling us that we've got increasing levels of mental health, and the definition of healthy with regards to South African youth, adolescents and youth, is one that's really needing focus, because we cannot, in all honesty, say when we look at the physical, the mental, and the social well-being of young people in South Africa, there is a complete sense of being okay.
Yeah. Let's focus then on the first two, and then we'll come to the cancer situation as well in a moment. But you're pointing to a fact of if children are giving birth at 10, it means there's abuse and parental involvement, or at least adult involvement in some sort. And there are failures on two fronts, from social services point of view and from the SAPS point of view. Let's start with the police. Why are police failing to do what they are supposed to do here? Is it a lack of reporting of these incidents, a lack of awareness, I suppose, from the families that they've got to report these incidents, and therefore for the police to kick in? But also, what role possibly do you think social services could play here?
So let's start with the role of the family, and let's start with me telling you a story of a live birth that happened in Limpopo probably 2 years ago. I was talking to the Department of Education there, and they were just basic education. I think it was a 10-year-old who had given birth, and we tried to unearth what happened with this 10-year-old. And the story was that the mother of the 10-year-old had hired a man to look after her cattle, but she didn't have the money to pay. So she gave this man her daughter. So you've got a situation where families or mothers or adults are using their children to pay for services to adults who also should know better. So you will have situations where there will be no reporting, and that non-reporting is deliberate. You will have families that will accept inhlawulo when a young child has been impregnated, and then the reporting at a family level doesn't happen. And then there's also the issue of working in silos. So, you know, when you look at the pressure that a health facility, a primary healthcare facility would be under, they want to deliver a healthy baby and let a healthy baby go home. And so there's a lot of touch points, a lot of players that should be coming into the picture long before a child gives birth. Yeah. There's the home that is failing the system. There's a school that should be saying, hey, we're not seeing this child in school, what's going on? Yes. And then there is the social workers that should be coming in long before the health system gets involved.
But also I'm imagining, sorry, Dr. Nkomo, I'm also imagining there should be a trigger even at hospital level when you admit a 10-year-old to give birth to say, hold on, where is social services? Maybe call a social worker here. Let's investigate this further, because it should not necessarily be a norm in a hospital that you get a 10-year-old to come and give birth.
Absolutely. And then the question becomes, are those policies in place, or they are and they're just not being implemented, or there's just too much to do that reporting this is the last thing on the mind because there's the next baby to be delivered and the next baby to be delivered. But I mean, the hospital or the clinic is the last place where this thing is happening. And it is really about, to what extent are we going to be serious about holding accountable adults who should be protecting children instead of being complicit in their abuse? That's really the conversation we should be having.
The question of mental health in young people, I mean, it's a cluster of issues, I suppose, that come to play. Has it got a lot to do, you know, anecdotally, when you watch young people on social media and they make a joke of this, and they say the older generation does not understand this question of mental health, you know. Either your parents will tell you don't sleep enough, ambulala, or you're not eating, or they say, siyasabukhuluma nalo because uzothi siyamtrigara, or things like that young people are making jokes out of. But I suppose they are making an indication of saying there is a conversation maybe that is not happening, that should be happening.
Absolutely, Thabo. In those jokes, there is truth. And the reality is that we need to be doing much more to understand mental health. And especially in the Black African community. You and I grew up thinking that somebody who's got a mental health problem is mad. And so as long as a person is not, you know, walking out in the streets carrying bags, there is nothing happening. But we need to understand that the spectrum of mental health can go to from being anxiety, depressed, to, you know, more serious disorders. And the onus is on us to start educating the older generation around how much more pressurized the lives of young people have become. You talk of social media, but you also talk about the real structural drivers of depression and anxiety. Right now, we've got students who are finishing their degrees, and they're highly stressed because they don't know what next. I get my certificate, then what? Because unemployment is so high. So we need to be cognizant of that and start doing much more to educate ourselves as the adults, as the older people, in understanding mental health and normalizing talking about it and seeking help for it.
From your experience, cancers fluctuating at the highest level observed around 2017, most adolescents were diagnosed with leukemia, Hodgkin's lymphoma, as well as bone cancer. These hereditary diseases, are these based on nutrition? What are these types of cancers caused by?
You know, I am not a medical expert, so I wouldn't want to venture to start to try and explain why we're seeing such a rise in cancers in adolescents and youth. But suffice to say that one would need to look at lifestyle. What are they eating? Are they exercising? What is their mental state? Because that does play a role as well in terms of diseases that young people end up having, which are non-communicable diseases.
Yeah.
But to go into depth at that, I'll be out of my depth in terms of expertise.
Yeah. In terms then, broadly speaking, on mortality, I mean, external causes which include accidents occurring at places of residence, assaults, and so on and so forth, and then including diseases. What are the contributing factors to a decreasing, I suppose, level of mortality?
What are the contributing factors to a decreasing level of mortality?
Yeah.
It would be I think that's a difficult one to say, because the research that you're talking to doesn't really go into depth around that. But I think what the takeaway for me from that research is that if you look at what are the causes of deaths of young people, women, the adolescent girls and young women is really related to HIV and their sexual and reproductive health. The men, the boys and young men, they're killing each other. It's violence. And that's where we now need to start zeroing in. We're zeroing in trying to arrest the sexual and reproductive health issues of the young women, but we need to do the same around this violence that's killing the young men.
Well put, much appreciated. Thank you very much for your time, Dr. Linda Ncube Nkomo, CEO for LoveLife, there, helping us in that intervention. Still